Welcome to this episode of Patient Voices in HIV Management, a CE podcast series. If you are seeking continuing education credit, please review the disclosures and the requirements for successful completion of the activity prior to listening to the podcast. A link is found in the show notes that can direct you to this information. After listening to the podcast, please go to practicepointcme.com to complete the post-test and evaluation to receive continuing education credit. Joining us in this episode is Dr. Monica Gandhi and her patient, an African-American heterosexual woman with HIV who is a heart transplant recipient and breast cancer survivor.
Hi, it's so good to see you today.
It's nice to see you also.
I actually kind of want to start from the beginning and ask you to go back in time and tell me again about the circumstances when you got the diagnosis of HIV.
Well, I'll go back about 25 years. I had given birth to my third and youngest child, and I developed a condition called postpartum cardiomyopathy. No one during the time I was very sick and I was in the hospital and testing was being performed, no one's asked me anything about HIV. Had I ever had an HIV test? I believe at that time it was only believed that people who were intravenous drug users or people who were in men who were in relationships with other men were the ones that were at high risk for HIV. I think that the doctors were a little nervous about broaching the subject because of my socioeconomic background. I had never worked in the sex industry. I had never used street drugs, so no one said anything. Well, I went to my longtime primary care and she did the tests for me. And when it came back positive, she was just shocked. Yeah. She was just absolutely shocked. She didn't think it would come back positive. And when I found out, I was freaking out because I had gone through an entire pregnancy without the benefit of antiretrovirals, had no medication, and I was nursing. I was very concerned about having my children. I think my baby was about 14 months old and my oldest one was about 8 or 9 years old. So I was very concerned about having them tested for HIV in the main medical center in the city I was living in. Because I wanted things to remain confidential.
Yes, they would do an RNA test by PCR to make sure that there's just not even a possibility that they have HIV, because sometimes the antibody, isn't as definitive. So that's great. And everyone was negative. And so then were you able to access healthcare in terms of you getting on HIV treatments, you getting the support that you needed around the time of diagnosis? Like, did you get to a doctor who specializes in HIV? How did that play out?
My primary care did send me to a doctor who specialized in HIV care. And also I became affiliated with the AIDS Foundation in the city I was living in.
Yeah. Okay. So then did you start on medicine right away?
Yeah, that's when I started on the medication. And over the years, I have taken so many medications. I mean, it's been at least 23, 24 years.
You started on HIV medications pretty soon after the diagnosis.
After the diagnosis, yes.
Yeah.
And I was afraid to take them because I had heard patients saying they would have horrible nightmares and they were having rashes and other side effects. And so I actually was given the drugs by the pharmacist. They were in my possession, but it took me a few weeks to get up the nerve to take them.
But how did it go when you got on them? Because you were on some old regimens, at the time.
I did quite well on the drugs. I don't remember having too many immediate side effects. I think that in the long run, after being on the drugs for a length of time, I do believe I may have developed some issues with my bones. And then I remember when I had a surgery and I had to take some new drugs, the doctor alerted my surgeon and the doctors that were caring for me that I couldn't be on that drug any longer if they were going to put me on particular drug.
I mean, you eventually ended up being on efavirenz, tenofovir disoproxyl fumarate, and emtricitabine in one pill for a really long time. And you were on that regimen, really for 2006 to 2019. But how are your interactions with the healthcare providers at this point? Like, good? I mean, we didn't see each other till later. So, how was the connection? Were you getting support in your HIV clinic? You were in a different center at that time.
Yeah, initially, I would drive to San Francisco from the town or city I was living in because I really wanted my care to be very private and confidential. And I was just afraid that somehow my diagnosis would get publicly exposed because of the environment in which I was living in. And I had a private doctor. She was known as one of the premier HIV treatment doctors in San Francisco. So I think I stayed a patient of hers for about 10 years or more.
And then you came down to our center. And at this point, we have, you're taking the efavirenz, TDF, and FTC. You had the heart transplant medications because you had gone through a heart transplant, of course, which is a really dramatic, event in your life and event in your health. And so we had to think about drug-drug interactions. And ultimately, we did change your HIV medication in 2019 to dolutegravir, abacavir, lamivudine.
Yes, and you're correct. My HIV medicine was changed after I had the heart transplant surgery because the heart transplant doctors had to put me on some medications that would interfere with the HIV drugs I was on. So the drug was changed. I have been on so many HIV drugs, to tell you the truth, I don't even remember. I don't even remember all of them.
Well, I mean, so I know because we made that change that you got onto dolutegravir, abacavir, lamivudine in May of 2019. And it was working. I felt like I had fewer side effects for you, and you were having some of the neurocognitive issues with the efavirenz that just can make people feel like their executive functioning is not as sharp as it used to be. And the TDF, given all your other medications, we didn't want that, and so we switched you over to this abacavir, dolutegravir 3TC, and it went well. And then the long actings came out, and I would just love to hear your thoughts on, did you want to switch to the long acting? Like, what were you hearing about it? What made you want to do that?
At first, I was watching television commercials. So that was of an interest to me, that a patient could be given an injection and you wouldn't have to have another one until 2 weeks, 4 weeks, 8 weeks. I'm not sure what the time frame is, but I think when I initially started the injections, I think I was coming every 2 weeks. Is that correct?
Well, so, it's every 4 weeks at the beginning. So the injectables that we switched you to were cabotegravir and rilpivirine, because that's all that's available. I mean, there is one injectable called lenacapavir for multi-drug resistant HIV. You don't have that. You have HIV that doesn't have any resistance mutations. And my impression, and tell me if this is true, is it was kind of for more convenience, that you didn't have to take, you already had pills that you were taking for other conditions, that you didn't have to take your HIV pills every day. This would be easier for you.
Yes, that's correct. That's why when I started seeing the commercials, I was really excited about the possibility not having to take more medications than I was already taking. So I'm taking a dozen or more medications for other conditions every day. And then you compound the amount that I have to take with taking oral antiviral suppression. It was just a lot. So I was very
So
happy to
many, yeah.
hear that. Yeah. And then when I would have appointments with you, I would ask you about how your patients were doing on the injections. And so you were giving me favorable reports. So I was thinking, okay, I should try this, right?
How did it feel like when you started it?
I think the transition was easy because you did not have to titrate me down on the oral medicine that I was taking prior to making the transition to the injectables. So that was good. And I was warned that there would be two injections. One had a thin liquid, and then the other one was thick, and that the thicker liquid would hurt more than the thinner liquid. So I said, oh, okay, that's fine. I got my injections in both hips. Thin medication didn't really hurt.
Okay.
But the thicker injection hurt when it was being injected into the tissue. But I would have pain sometimes for 5 days. It was very painful. It was very painful. I would limp. I would literally limp around. It was very hard sometimes for me to sleep because I'd have to make sure that I positioned my body that wasn't applying pressure to the injection sites. So it was.
So you're having aching pain in your buttocks where the injection had gone. Yeah. And was it sharp aching? I mean, it really sounded like it was bad. 5 days is pretty long. Did that get better?
It was aching pain.
Aching pain.
But it eventually would go away. But by the time I was free of all the pain, it was time to get another one.
Because we were doing every 4 weeks at the beginning, and there were short periods of time. So how did it feel like to go to the 8 weeks then?
It's kind of like valleys and peaks.
Okay. Okay, that's fair. That's fair.
I got used to it probably after the third time that I had to visit for my injections. And then I noticed that if the nurse would place the injections in a certain part of my backside, I didn't get a lot of pain.
Well, that's good to know. I mean, we have to keep on watching it, and at least it's not so often. I mean, you have time in between, to rest. And so we're going to keep on monitoring. If you look at your whole journey of HIV medications, that you've just gone through. I mean, you start out with some of the older oral medications. You did have side effects on them, but you kept with it. You always took your pills every day. You were really great about it, actually, because you've always had an undetectable viral load. And your CD4 count went really high. I guess I would end with, what are your key learning experiences?
Well, I think that when an individual has HIV, it could become a very isolating and lonely life, particularly if you are not sharing your condition with everybody who is in your inner circle. I have chosen not to share with some people because of their beliefs, and I call them false beliefs of what this disease is and how it can be transmitted. I don't want judgment. So I've had a very lonely life, but I've also, because I'm in San Francisco and we've always been on the cutting edge of HIV and AIDS medications and treatments, I think I'm lucky because I do have support. I can go to different organizations in the city, different HIV organizations. So I can be around other women that have this disease. What I would like to see more of, though, is I'd like to see more services for women who are still kind of in the closet about their disease. Because, see, I think where the stigma comes in is that people in the general public who don't know about this disease and how it's transmitted, they think that they want to judge you morally. They want to
Yes.
say, "Oh,
No, there's stigma still.
you
Yeah.
must have been a prostitute. Oh, you must have taken drugs. We don't care what you say, even though you say you haven't done those things. Oh, yeah, we know that, because how else do you get them?" They don't understand a virus is a virus, and a virus can penetrate the body of any human being.
That's right. We're all susceptible in that way, and that stigma is still there. And I think you've really
Yeah,
experienced it. I found it very unfair, and what I've really appreciated is how much you yourself have reached out to help others.
there are women like me who've gone to college, who've had professions, who've been married, and have never had any dealings with law enforcement or prison or anything like that, who has raised her children to be successful, is making sure that her kids have a good education. I'm that person. And there are a lot of other women like me, but they're in the closet about it. So I wish there was something more that could be done to get some of these women like me out of the closet.
Yeah.
I know they're there. I just, don't know how to tap into them, because I'm sure that some women, given their socioeconomic status, that they feel uncomfortable sometimes going to certain places because they don't find anyone there that they can socialize with.
Yes, I mean, that's what I appreciate about you, because you've reached out past those boundaries and those distinctions, and you have mentored people on how to take HIV medications and the importance of them. And it's just been a pleasure being your doctor for so many years. And I really thank you so much for talking to me today. I think we all learned a lot about orals, about injectables, about there's trade-offs for everything, and about persistent stigma. So thank you so much. And it was great to see you.
You're welcome. Likewise. Bye-bye.
Thank you for listening to this episode of Patient Voices in HIV Management. Please go to the activity page on practicepointcme.com to complete the post-test and evaluation to receive continuing education credit.